So we're gonna awkwardly go over how to give a shower. So let's say that your patient, let's pretend that the bedside commode is a wheelchair. So your patient's sitting in their hospital gown in the wheelchair, and typically, you know, so they probably have a brief on, there's nothing on lower extremity for dressing. So we're just, when we talk about doing the transfer, we're not doing anything different. We're still gonna put a gait belt on, but here's the thing. We don't ever want the gait belt to be on bare skin, right? So if they're in a gown, take another gown and put it on the back, and then you're also, well, I could do it this way, or I could go like this. Can you go ahead and put this on like a robe? And then I'm getting an assessment of like some upper body dressing, and I'm seeing range of motion, all those good things. And I can also see, I can kind of get a level of assist. Now this is a little bit more of an assist just because it's kind of bulky, but it's still giving me an idea in my head, right? Because a shower task, it's like, can she reach this to shower? Can she reach that to shower? What am I dealing with? So even just handing you the gown. And so I'm gonna go ahead and put on the belt, because, and now I don't have to worry because it's not on bare skin. Never put a gait belt on bare skin, because that's not fair for anybody. Okay, nice and tight. Here's your nice tight hug. Just tiny. Okay, through. Check her. She's in nice and tight. Okay, so there would be a walker, or if this is a wheelchair. If this is a wheelchair, most facilities will have something where it's like a low threshold, where I could wheel her directly in to do the transfer. So if I was wheeling you, I pretend I'm wheeling you in, wheel. So you're gonna pop, I've got her right here. So we're actually, keep walking. We're gonna pop right over. So she's literally gonna be right here. And the reason I want her that way is so she can use these grab bars to help her stand. So if she can't ambulate, but she can do a stand pivot, so I want to get her as close to the grab bars as possible so she can lift herself, right? And so if I come like this in front of her, this is like a train wreck, right? So I'm going to have to kind of have her put one hand up here and here, and I'm going to have to lift her this way. Never take my hands off, slide them around, and go ahead, and I can lower her down. I mean, obviously, she's more of an assist, but if I was going to use the wheelchair, wheel it right in and give her the best mechanical advantage possible. And that's why it's awesome to dress people in the shower, or not in the shower, in the bathroom. There's grab bars everywhere. Okay, so if she was coming in, let's try it again. But this time, she's using a walker. So just aim like she's using a walker. He's using a cover. And she comes in, right? I'm going to come on this side, and I want her to take this hand and put it on the grab bar. I'm going to take the walker away. If she's super unsteady, I can put it in front of me. So if this is the frame, this frame is here, the other piece of the walker is out here, so she can still have a hand on something. And then it's the same rules. She goes back till she feels it on the back of her legs, and then she goes ahead and she lowers down, right? So the transfer in is nothing new for you. The transfer out is kind of nothing new for you. Okay, so once she's here, okay, the upper body is the last thing to doff, okay? And it's the first thing to don, because once again, you gotta have that belt on. So if you keep thinking in your head, don't ever put a gait belt on bare skin, then you're good. Okay, so she's sitting, she's safe. I can, if she's weird with her like core balance, I'll keep her dressed, upper body, and I'll have her try to undress her lower body and keep a hand on her, just so if she has bad core balance and stability, dynamic sitting stability. So once she's undressed from the lower body, then I'll come over and I'll take the gait belt off. Okay. I feel my feet want to come off.
Are your hands shaky?
Yeah. So, Crazy. Okay, so now I take the gate belt off. Okay, and you already had your materials, right? You don't even start this task without gathering your materials first, because you can't leave a patient. These are fluffy towels.
I was gonna
Nice.
say that too. You brought some fancy
Nice.
stuff here.
So nice. I never get these at work. Okay, so I'm gonna go ahead and ask her to take off the outer rope. Once again, these are levels of assist that I'm just kind of going along with, okay? And she can rock her tush from side to side to get it off. And I put it within reach, right? That she would probably be donning a fresh gown or a fresh top at this point. Okay, and then I'll undo the back for her because that's not fair, right? Okay, and so then she'll go ahead. Now, as soon as this drops, I'm standing behind her to protect her privacy. And I'm gonna hand her a towel because I want her to have that dignity and that privacy. Okay, she deserves that. Everybody in America has been seeing her in the hospital. So let's give her some privacy. Okay, and then I'm gonna open it from the back. Right, and I always wanna stand behind her because coming this way, she has no privacy, right? So I'll take the shower head off, I'll hand it to her, I'll have her point it to the floor, right? Put the water on, she's seated, so she's safe. So don't start a bath without somebody already being seated safe, because it's like, now it's a slippery mess. So then she finds the temperature that feels good for her, and once she has the temperature that's good for her, trap the heat, close the curtain, go ahead and take the towel, and I stand right back here. And I never leave. And she does her showering, la la la. And I'm watching her from the back, I'm looking, I'm assessing her level of assist. We're talking, I'm making sure she's talking to me, that the water's not too hot, she doesn't feel funny, she doesn't feel dizzy, any of those things. So I'm behind her, curtains closed, trap heat, blah, 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 blah. Got it? Mm-hmm. Okay, questions so far? Mm-mm. Okay, I'll just do a general shower and then I'll talk about special needs and stuff with wrapping wounds and things like that. Okay, so when she's all done, right, I'll have her just drop the head of the shower. She'll turn it off. Okay, then I'll peek around and I'll open up and I'll peek around and I'll hand her a towel immediately to put on herself like this. And then I get a smaller towel and another towel, and I come behind her and I put the towel over her back like that, and then I hand her the smaller towel because the smaller towel doesn't hold as much moisture, so it's not going to be heavy for her. So this will keep her warm. I'll take this from her and I'll put it right here. And so now the floor, I gotta mop the floor because the floor gets wet. Right. She's drying and drying and drying, doing everything she needs to do. I'm talking, we're assessing levels of assist, all that kind of good stuff. Okay, so now I am going to dress her, right? Or she's gonna dress herself, I should say. Sorry. She's gonna dress herself, but I can't stand her. I won't put a gate belt on until what?
She has a gown on.
I always dress the upper body first because I can get a belt on her quicker. And I want a belt on her as fast as I can because the faster I get her belted, the safer she is. So then I take what she's given me. I'll keep the small towel just to make sure that she doesn't need it to dry anything else. Okay, so if it's a shirt, she's donning her shirt, which means if she harnesses the ladies, I need to give her her bra. I need to make sure she's dry. Underneath, everything has to be dry under her breast because it can get fungus and any kind of wounds. So she's thoroughly dry. Give her her bra if she wears one. If she doesn't, then just hand her her shirt. Deodorant, you hand it to her here if she wears it. And then dress the upper body and then I can move on. Does that make sense? Mm-hmm. As soon as her upper body is dressed, I can belt her. And if she has poor sitting balance, then I want to belt her as fast as possible. So that the same way she undressed or doffed her lower body, she can don with her lower body and get dressed, and I don't have to worry about her bending over and losing her balance or anything like that. So I belt her as fast as possible. If this was the only thing she was wearing, I would have put the robe on the back just to make sure it's never touching her skin, but she's got a shirt. So I'm pretending that this is a shirt now. Okay. And then she'll finish what she needs to, and you transfer her the same way you always transfer. Put the wheelchair right in.
Okay.
Put a towel on the seat of the wheelchair to dry her tushy. I like to dress people out here for lower body. And I'll show you why. Okay. So if the upper body is dressed and she's in her wheelchair, skirt, 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 skirt,
We'll switch a room.
this is Katie in her wheelchair. There's not a big old trash can in the way. Okay, so she's going to sit here. So this is exactly what I like to dress it, to have her dress, lower body, in the bathroom area, because she has all of these grab bars. So even if it's me who's doing the lifting of the pants, and she can thread through, she can at least come up and I can put the pants right up. But without these, I don't stand a chance. Otherwise, she's doing a tricep push-up, and she's not getting up high enough for me, right? So does that all make sense to you?
Mm-hmm.
Yeah.
Okay. So let's talk about, you can stop facing the wall. Go ahead and send the thing. So sometimes you have patients with like wounds and dressings. Anytime that there's a wound or a dressing, you always check with nursing to make sure it can get wet. If it can't get wet, you know, if there's no waterproof bandage on it, then you have to cover it. So how do you cover it? Right. So trash bags are phenomenal for covering it,
Okay.
and a roll of paper tape. So when I'm in skilled nursing, I carry a pair of surgical scissors,
Okay.
put it on your clipboard, a roll of tape, and a couple of flat trash bags. You can get them in somebody's room if you open up, you know, just like I said with Ted hose, they're
Yeah.
kind of underneath. Take a couple, put them in your clipboard. So let's pretend that Katie has a wound on her leg, just because it's easy for me to reach. So can you hand me a small washcloth or a small towel?
That's the big one.
Okay, so let's pretend that the wound is like right here. Or let's just, she had knee replacement, and for some reason they did not put a waterproof dressing, or what's called an island dressing. It looks like a big rectangle. So I know that her wound is here to here, and it's a paper dressing, and I can't get it wet, okay? So I'll take the trash bag, and I'll wrap it around her leg, and I'll tape it here and here, and sometimes you can even take a towel, and the trash bag is over, and then you can take a towel and take the towel here, so when the water comes down, it gets absorbed in the towel. So the trash bag is here over the wound, and there's a little towel here. And it takes me so long to prep people to take a shower sometimes, and the shower's 5 minutes long, but that person will love you for giving them a shower, because it feels like awesome. So if there's any kind of opening or wound, I always take a trash bag and wrap it. So with tape or a towel. So then the rules would be for washing that the water has to flow down. Because if they shoot the water this way, it's gonna get out, so go down. So you can take the towel along the top, it's totally fine. PICC lines are probably the biggest thing you're gonna see.
Okay.
And so if your patient has a PICC line and it's in the arm, like right here, then that's easy to wrap. Same rules. Take a trash bag, wrap it around. You can take the corner of the trash bag and tuck the little PICC, you know, like at the pleat at the bottom,
Okay.
and tuck the PICC line into that and keep it a little extra dry.
Okay.
If it's a port in the chest, I can't cover that. And so, I don't know if they would be a safe candidate for a shower, unless there's a special dressing that nursing can put on.
Okay.
Does that make sense?
Mm-hmm.
Okay, and the same rules, like, if it's cardiac, Goldilocks zone for the temperature of the water, not too hot, not too cold, and all of those same rules. I mean, this is super quick, but you
Yeah.
get it.
Yeah.
If, it would not be weird for someone to have a bowel movement in the shower. It happens all the time, because people like relax in the shower,
Mm-hmm.
or they've been given something that's trying to stimulate. So if you feel that somebody is at risk of having one, instead of using a chair bench, have them take a shower on a bedside commode.
Okay.
So, and then just put, instead of the bucket living in here, because it's just gonna catch water, put it on the floor underneath to catch.
Okay.
Does that make sense?
Yeah.
Okay. And it's easier for perennial cleaning,
Okay.
because they can wipe themselves and use the hand shower to keep it clean. Okay?
Mm-hmm.
It's a good idea.
Questions on anything? I know that was super fast.
No, that was a good refresher though.
Okay.